In the spring of 2020, Outright Action International established a COVID-19 Global LGBTIQ Emergency Fund to respond to the needs documented in its report, which was called Vulnerability Amplified, the Impact of the COVID-19 Pandemic on LGBTIQ People. Outright fights for the human rights of LGBTIQ people everywhere, working at international, regional, and national levels to research and also document and to defend and give advice about human rights for LGBTIQ people. The Emergency Fund, according to the Outright report, has raised since April more than $1.2 million and has given $1 million of that in grants of $2,500 to $10,000 to 114 organizations outside the U.S., Canada, the European Economic Area, the United Kingdom, Switzerland, Australia, and New Zealand. It's giving the money to places that are much, much more poorly funded and much less rich than those countries. The recipients of the grants are queer groups in 63 countries. The average number of people benefiting from each grant is 437 people. 55% of the money was for food. 20% was for health care, and 9% was for shelter. On October 14th, Outright conducted a webinar that included speakers from 4 global regions describing the conditions of LGBTIQ people there and the ways that grants from the Emergency Fund had helped alleviate dire conditions for LGBTIQ people. Tonight you'll hear excerpts from that webinar. The first speaker you're going to hear is Jelena Vasiljevic from Serbia, and she is from the Equal Rights Association for the Western Balkans, Turkey, and Serbia. She talks about health issues, and then she talks about the setback of the LGBTIQ movements in that area.
Basically, what happened at the beginning of the pandemic is that, health systems crashed. And when the system crashes, the first people who are dropped out are basically LGBTI people. And that actually happened regardless of the fact that if LGBT people are in gray or black economy and they lost their jobs, and with losing the jobs, they lost the possibility of seeking the healthcare in any way. But even if you have everything that is necessary, when you at the beginning of pandemic, even now, when you go and you ask for the specific healthcare, regardless of your HIV status or in terms of trans community for the endocrinologist, you are always you're always having some challenges and issues basically when you try to access the healthcare. In terms of why you don't need that, basically it's COVID situation, just like we will deal with you later on. We will not deal with your health challenges now. Regardless of that, we have also one specific theme that nobody seems to be noticing, at least not here on Balkan region, is that we have intersex persons which are highly invisible, and even in that invisibility, they're not seeking the healthcare. The healthcare for intersex persons is completely erased. So basically, we are multi-level challenges are faced basically by the community, either on Balkan region, and I'm hearing it also globally. It's not just like in Balkan region. It's just like access to healthcare for trans, intersex, and LGBTIQ people is just like gone, basically gone. And that affects us on various levels. I've already spoken with some organizations which have received the funds from Outright, and they're grateful for it, because they had the opportunity to provide the necessary medications to the community. And that's why, these initiatives and these funds are quite, I would say, golden for the community in terms of it's like operational grant, and people can basically assist the community that we are basically living with. And basically, it's perfect. On the other end, we are just like also hearing like questions are is this like one-time thing? Because we are having the first wave, we are expecting the second wave, or basically in Balkan region, the third, the fourth, and etc., etc. We are expecting new waves, we are expecting the new lockdowns, we are expecting the new and more visible challenges for the LGBTI community in terms of like losing the employment, losing the healthcare opportunities, losing various status that we basically fought for the previous decade, and what basically we could expect from various. I mean, we are always expecting the good practices which are global, but on the other end, we are also seeking like what to do next. Because if we have the second lockdown, we will have the rise of like community members asking us for assistance, and we will not be able to provide it because we have no mechanisms. We don't have tools to communicate either with state, either with funds or whomever, to see how we can basically assist them in that terms. And back to the health system, we are also seeing that besides the fact that the state is not providing the health care, organizations are trying as much as they can and succeeding as much as they can in provision of the assistance, in medical assistance, basically. But what we are basically we are trying to access also the businesses to try to see what are their possibilities, especially in this time, in terms of asking for donations, trying to see what their possibilities are for opening up more towards the LGBTI community, and trying to see either to get the employment for the LGBTI community, and to see what are the possible risk in terms of second wave, third wave, and et cetera, et cetera.
Yeah. I mean, I think it's a huge question where we all go from here.
Yeah.
I'm really struck by your description of the health situation. And of course, we're talking about, in this case, physical health, but let's also talk about mental health. What we know for sure is, the kind of pressure and the isolation that the pandemic has caused for so many people who have, before the pandemic had found chosen families, had found communities where they could be themselves, and now the pandemic literally has cut them off physically from that kind of support.
I mean, I'm pretty much still at the same point, because the organizations have been closing down rapidly because of the lack of the funds, because majority of the funds are now either turned to the advocacy still somewhat, but direct assistance, and it's directly connected to COVID-19. And some organizations are not working directly with the LGBTI community in terms of direct assistance. And basically the funds in the Balkan region are just like shifting. We already saw the shift from the Balkan region towards the Russia region, Eurasia region in general, and then to Africa. And basically, which is quite fine in terms of, empowerment, the other communities which need also the assistance and help. But in terms of, we've been shifted more towards the EU funds, and considering the fact that not all LGBTI organizations have the capacities to even to access those kind of grants and either to implement those projects, basically, we still have the, plus on that, you have to bear in mind the difficult situation within the, COVID situation and pandemic. Then everything is kind of shifting, and it's shifting backwards. We're not moving forwards. The only thing that we are seeing that maybe it's like few steps ahead of us is basically that we are now more digitally aware, more technologically aware. We are now more online. We're not organizing the workshops and conferences in physical space. We're not using the funds for the travel and accommodation, but now we're using it towards the platforms, towards the campaigns, towards the different activities. But also bear in mind that our governments are not so technically evolved. So basically, when you try to organize the advocacy meeting with someone from the government, you have first to have the information if the person knows how to use the Zoom platform, for instance. And basically, all this in Balkan region, you have also now we are seeing the wave of centered right government being appointed throughout the region, and you're not having the opportunity to communicate or to have the difficult conversation with the specific institutions, because either they lack the technological knowledge or the access towards the technology, either they're not interested in having the conversation on online or in person, and on the other end you don't have enough staff because organizations are closing down and lowering the budget, lowering the capacities, lowering basically the staff. And on the other end, and then you see that it's like movement throughout the region, because grassroots organizations are now more focused on accessing the small grants towards helping and directly assisting towards the LGBTI community in terms of COVID pandemic. On the other end, you have bigger organizations, so-called, that they're accessing different kind of funds and maybe closing those little small funds routes and etc. But there's and those organizations are also lacking funds. So funds politics and program politics are shifting. The state politics is shifting, and the only thing that you're seeing basically is that LGBTI community is not getting anywhere. Mm-hmm. They're still sitting at home. They're still having the same basic needs not being met in terms of either, as we already spoke before, either food, medication, employment, access to healthcare, access to anything. And even if we have, and on the debt, if we add the specific measures that states are implying to, they will have us under, which it doesn't give you the access to freedom of assembly, freedom of expression, of your expressing yourselves. Then you're seeing the major issues on various levels now, not just political levels, but also in terms of movement, regional movement and global movement. We're just getting set back and back and back.
Yeah. I mean, you're talking about really constraining basic human rights, basic rights for assembly, for meeting.
That was part of the comments from Jelena Vasiljevic, who is from Serbia, talking about the situation in the Western Balkans, Turkey and Serbia, for queer people. This again is from a webinar conducted by Outright Action International. The next person you're going to hear is, with some commentary about Brazil, is Tulie Araujo, Executive Director of the Libertarian Union of Trans People and Transvesties. And she describes the economic and health crisis for queer people in Brazil and the violence toward them that is partly perpetuated by the Bolsonaro government's policies. So here is Tulie Araujo.
First, I'd like to thank you for the invitation. It's an honor being here. And I can say just the same that Nish said about the employability of LGBTI people in Brazil. By discrimination, we're mostly on the informal employability market and sex work. And Brazil was already experiencing a slow recovery from a recent economic crisis with very high employment rates for the general population, especially for young people. And our work, it reaches more young LGBTI people. So the unemployment was already a big issue before the pandemic. For vulnerable groups, these rates were reaching alarming levels. And when the pandemic started and the social distancing policies started being applied in the whole country, and the federal districts, Brasilia, the capital of Brazil, was the first state to develop a social distance policy. The unemployment was almost immediately for trans people and LGBTI people in general. So the people who are inserted in the labor market, formal and informal, were like in a month they were unemployed. So as Paul said, the first demand received was related to the basic needs to keep living, like the rent payments they couldn't afford. And by that, we've developed an articulated work through many organizations. So a lesbian organization developed a mental health program to attend LGBTI people in risk situation. Ultra distributed more than 200 food baskets, food basic kits, and health basic kits to make the necessary hygiene to keep safe, and masks. We did that by working with LGBTI people who are unemployed. We bought the masks from trans person and involved many trans persons on this process. Despite these difficulties, the emergency financial aid policy developed by the government was had a minimal security for the LGBTI population in Brazil, but it was developed in 5 months, and when the government renewed, it was the half of the amount of money by the first time. At this moment, the biggest challenge we're facing is to reinsert these people who was in the labor market and continuing the work for insertion of those who wasn't, and make the sex work sharing information to to access the healthcare system. Since the election of the president Jair Bolsonaro in Brazil, and the conservative movement growing up in Brazil very fast, LGBTI community and especially trans community in Brazil were already living in a kind of social distance for those who that was possible, because the violence rates were increasing much fast in the past few years. The social distance policies were subject of a major political dispute between the federal government, specifically from the president Jair Bolsonaro, and the governors in the states, because the president was against the minimum social distance policy, and the governors needed that to lower the rates about the COVID transmission. The political dispute made the population encourage a perception from the population that the pandemic was not so important or so dangerous, because the president made public appearances without using masks. For you knowing, he started using masks in July, so the pandemic was much lower. We have almost 100,000 people that died when he decided that it was time to start using the masks. So that made the mental health of the LGBTI population much more vulnerable in the context of the pandemic. At the same time, there was an attempt to return the economic activities long before it could be safe. So the population, and especially LGBTI population, for the employment issues, they were most vulnerable on this context. Mm-hmm. So we had a big loss of LGBTI people, of trans people in the trans community, and trans leaderships from the social movements in Brazil. And that affected not only the mental health in the in the personal sense, but it affected the mental health in a collective way, affecting the organizations, affecting how we could do our work, the work we were doing that were, major and important at the moment.
You've heard from two of the speakers that were part of a webinar that was conducted by Outright Action International. That was Jelena Vasiljevic and also Tulie Araujo. If you would like to contribute to the emergency fund that is helping people in organizations around the world who are LGBTIQ, you can go online to Outright Action International and make a donation.
Welcome to another edition of Progressive Community Media. I'm John Riley. This show covers changes in progressive media and also brings to air shows and segments covering important but underreported issues. Tonight, I'll broadcast a segment produced by Out FM, a progressive LGBT radio show on Pacifica station WBAI New York. And Out FM co-host Naomi Brussel will be discussing the impact of changes in immigration policy on LGBT immigrants with Aaron C. Morris, the executive director of a group called Immigration Equality. But first, I want to talk about important but disturbing developments at the Pacifica Radio Network, national parent organization of WBAI, where I co-host Out FM. Last fall, Pacifica went through turmoil because a newly hired executive director, in cooperation with a rogue faction of the Pacifica board, fired the entire 200-person staff at WBAI and seized control of the station. All local programming was suspended and replaced with what they called Pacifica Across America, a mostly bland, stale hodgepodge of Pacifica shows from around the network. At the same time, behind the scenes, some of the same rogue directors instigated or cooperated with an effort to permanently change Pacifica's bylaws to make it easier to sell a station and disable democracy at Pacifica. They wanted to use Pacifica's referendum process to get the job done. WBAI was their target, and they wanted to disable the opposition to a station sale. Several of the architects of this takeover had previously said sale was necessary to save the network and had proposed dividing up the proceeds between other stations in the network. The destruction of WBAI's live, locally determined programming sparked an enormous outburst of opposition at the station and throughout the network. Supporters sued the network and then packed the New York courtroom, resulting in a judge's ruling that reversed the seizure, which he found was illegal. Meanwhile, the faction behind the WBAI takeover used scare tactics to collect enough signatures of Pacifica members to obtain a referendum on their complete rewrite of the network's bylaws to eliminate the democratic input into the network policies. Again, grassroots forces around the network mobilized, resulting in February in a 2/3 vote among tens of thousands of voters against the attempted rewriting of the bylaws. But the cost to the network was great. The referendum cost $150,000, an enormous sum for the financially strapped network. Now, just 5 months after that failed vote, the Pacifica faction launched a new effort called New Day Pacifica, aimed at gathering enough signatures to get their revised version of the bylaws on yet another ballot. This effort would again cost the network $150,000 or more. The new bylaws would abolish proportional representation on both the Pacifica National Board and the 5 local boards, shifting to winner-take-all elections that would shut up large political minorities. Their bylaws would also severely reduce staff representation on all the boards. According to former Pacifica board member Michael Novak, based at the Los Angeles station, quote, "It is unfortunately a bait-and-switch operation from the same people who were behind the costly shutdown and takeover of WBAI and the similar bylaws replacement earlier in the year that was resoundingly defeated by listeners and staff all around the network. This new version leaves the local station boards in place but neuters their oversight capacity, still creates an unaccountable majority on the new replacement national board, and maybe worst of all, institutionalizes a division between paid and unpaid staff, creating a third class of membership. This has nothing to do with good governance and everything to do with setting up a system that can sell off some foundation assets in the interest of preserving one or two stations with big personnel and payroll expenses. Signing the petition could force Pacifica to waste precious time and money at this crucial moment for the foundation and the country on an unnecessary and costly membership vote on yet another bylaws replacement," close quote. While Pacifica faces financial hard times that the referendum backers are exploiting, the so-called solution offered by New Day Pacifica would not at all benefit the Pacifica listenership. Instead, it would empower the rogue board faction that illegally seized WBAI last year. I also urge all members of WBAI and other Pacifica members to refuse to sign the petition. If, despite the grassroots opposition, this bylaws deform gets on the ballot, voting rights will be available to those who are members in good standing, meaning their $25 annual membership dues are paid up. So if you'd like to join or renew your membership, go to give2WBAI.org. That's give2WBAI.org.